I wonder if we could move the discussion on to think about kind of treatment and I guess for lots of your colleagues, treatment will mean medication. I wonder on your views, and I wonder if we could turn to you really, Helen, and say, well, do you think it's useful or helpful for a GP to start antipsychotic medication?
I'm very rarely this didactic. The answer is no. GPs really should not be starting antipsychotic medication before a young person is seen and assessed by somebody with real expertise in that field. So somebody from an early intervention service or somebody from a mental health team, depending on how the services are set up in the particular area that you're working in. And sometimes it's difficult because there is this sort of family pressure of something must be done. And also sometimes, of course, young people are incredibly distressed by their symptoms. Yes. Now, I think under those circumstances, if somebody hasn't slept for days and days, then I think using a low-dose benzodiazepine has a place, but that is just a crutch. That is just symptom relief until that young person has been seen and assessed. So no, not even the lowest, smidgenest little dose of antipsychotic, not in primary care.
The other point I'd make is that if you're dealing with someone who's got a clear psychosis, then use of antipsychotic medicine has a good evidence base. It's okay. It's, in my view, it's not for GPs to do that, but there's an evidence base to use those sorts of medicines. However, if someone has not reached a threshold for psychosis, then actually it's a disastrous thing to do, and that there are far better evidence-based interventions that are around. And so the skills required to decide if someone's reached a psychosis or hasn't reached a psychosis, it's not my job as a GP.
No.
So I don't want to take silly risks like that.
And what advice could you offer, David, in terms of a young person presenting who you think may have an emerging psychosis and they've not got a bond or psychosis? I'm sure lots of your colleagues would kind of think, I want to dive in and I'd like to do something. Is there anything that they should be doing in terms of prescribing?
Well, in some ways held them back a bit. I mean, the key here is engagement. So anything it takes to get the confidence, win the confidence of that young person and their family is time very valuable, time well spent. To be helpful in terms of maybe offering something to help you sleep or to reduce your panic if it's a low dose benzodiazepine. Okay, that's that. But the key here is engagement. So not to be deflected really, and to work around the young person's issues. Once we start trying to reframe this as a psychiatric diagnosis, we'll stumble, we'll get into trouble.
Yeah.
So keep it simple.
Okay, that's very clear, thank you.